Hello, everyone, and thank you for joining us today. We are thankful that you're here. I'm Jamie Swift, Director of Infection Prevention for Ballad. I just want to start our press briefing today with an update on our latest numbers. As a reminder, we're directing you to the Tennessee Department of Health and Virginia Department of Health websites for our total case counts. Our numbers are included within those numbers. This morning, within Ballad Health, we currently have 15 patients with coronavirus who are receiving care within our facilities. We now have about 300 beds that are available to care for COVID patients should the need arise. We have staffing, PPE, and the resources necessary for those patients. As we talked about Tuesday, just remember that we're continuing to see patients of all age ranges at this point, so from 6 weeks to 90 years. So we truly are in that community spread where we're seeing it across the community, across age ranges. So it's really important that everyone continue to take precautions, stay at home, and to follow the social distancing. Just a brief minute to talk about this weekend that's coming up. As we all know, Easter is coming, and that's a time we certainly want to spend with families and celebrate. And I just want to remind you, certainly try to connect with families, stay connected through social media, through apps, through telephones. But this is not a time to relax and to come together and think that one weekend won't matter. Truly, one weekend will affect our numbers 2 weeks from now. So it's really important that we ask that now is the time to buckle down, to really abide by our social distancing, to use FaceTime, to use telephone and talk to your families, but try to avoid those large gatherings and just stay home and keep our community safe as we get through this. That's all I have for this morning, so I want to turn it over to Dr. Patterson, President of Ballad Health Medical Associates.
Thank you, Jamie. I appreciate that. I'm here to talk a little bit about our urgent care enterprise. Across Ballad Health, we have 17 active urgent care centers. Our urgent care centers are often the first place that our friends and neighbors go for care when they find themselves sick. Interestingly, despite the crisis that we find ourselves in, people are staying home. Hopefully, they're following those instructions. But while they stay home, they oftentimes don't seek care. So our urgent care centers are under significant decline in volume. And due to these low patient volumes and the need to conserve much needed personal protection equipment, we need to announce the temporary consolidation of our urgent care program. We're going to consolidate 6 of our urgent care locations into the other 11. This is going to be effective on Monday, April the 13th. This consolidation is going to be temporary. We expect to reopen these as our volumes improve and this pandemic eases. The affected urgent care centers with this temporary closing are going to be in Jonesboro, Tennessee, with those patients directed to Johnson City. In Bristol at exit 7, patients will be directed to Abington, Virginia, or the State Street Urgent Care Center in Bristol. The Bristol Volunteer Parkway Center will also be affected, and these patients will be directed towards State Street in Bristol. Gray, Tennessee Urgent Care Center will also be temporarily closed, and they will be directed to Johnson City, Colonial Heights, or Kingsport. Elizabethton, Tennessee, patients directed to Johnson City, and the Marion, Virginia Center, patients will be directed to our Abington Center. This temporary consolidation will help us prevent lasting damage to our system overall and continue our region's high quality health care as we come together. This is necessary as Ballad Health, like other healthcare systems, is bracing for this COVID-19 surge, and while experiencing catastrophic declines in the volumes, we need to do this to keep our care at its highest level. We're going to consistently and constantly assess our volumes, and as we are able, we're going to open the closed centers back. I want to tell you that we really appreciate the citizens as they support us with their understanding and continue to come to our centers. Thank you. I want to introduce Tony Keck. He's our Executive Vice President of System Innovation and our Chief Population Health Officer. Thank you.
Thank you, Dr. Patterson. I've been asked to follow up on our messaging of physical distancing. We've been modeling the disease's spread in order to determine the demand on hospital beds for Ballad Health, and it's clear that physical distancing is the single most important thing we can do to reduce unnecessary deaths in the community and to reduce the demand on our hospitals. We really don't want to be overwhelmed like other cities, Detroit, New York, and New Orleans. We've had a small advantage in our region that our geography has protected us from the early stages of the disease, but that advantage has rapidly evaporated. We now have well over 150 cases in the Appalachian Highlands. That number is growing each day. We know that many more cases exist, and many individuals infected with COVID-19 don't show symptoms yet are still spreading the disease. For that reason, we have produced a scorecard on physical distancing. And you can see here the first map using anonymous cell phone data collected by a company called Descartes. This map reflects the reductions in the amount of total distance traveled post-COVID versus pre-COVID. And this data is within a few days of just being produced. The darker the blue, the better on this map. We are trying to reach a 75% reduction in total distance traveled before our pre-COVID period. You can see here that several counties have reached that. Dark blue is 75% or greater. The lighter blue is 50 to 75%. So we're doing a good job on reducing our total distance traveled. We're not traveling outside the region as much. We're not traveling to work as often. What's alarming is there's another way to look at this, and it's by tracking our visits to non-essential locations. And Google Maps has produced data that's publicly available on Google's website that tells us how often we're visiting movie theaters, restaurants, shopping that's not grocery or pharmacy related, essentially non-essential locations. Here you see a lot of red in this map, and that's because we have not been able to get over the 50% threshold, and many counties are still below 25% reduction in their non-essential visits. We need to do much better than that if we're going to stop the spread of this disease. We'll be trending this data over time so we can see how we're improving or declining. You can see here that over the number of weeks that we've moved from red to blue, which is a good thing in many of our counties in terms of total distance traveled. The Google data is new data, so we only have a couple weeks of it, but you can see that we're also improving there. And so the star improvers over the past week have been, not surprisingly, in counties where there's more of the disease. And so in Hawkins County, where we've had a cluster of cases, they have improved their physical distancing quite a bit, and the same thing for Lee County, which has had some cases spring up. So what we'd like to do is improve our social distancing, our physical distancing, before we have more cases of the disease. That's the single best way to prevent it. And so we'll be providing regular updates to the community on this data. And now I'd like to introduce Trish Bays, who is our CEO of our Behavioral Health Division.
Good morning. Today I'd like to talk to you a little bit about mental health and COVID-19 and the effects of pandemic on mental health for both the public and our healthcare workers. Stress and anxiety during this time is certainly heightened and compounded by the time that it's taking us to get through from the beginning to the end of this pandemic. While it is more difficult to quantify than the infection rates that we see, it is also significantly important to our region and to the health of our communities in addressing and recognizing the effect of stress and anxiety on our overall health. This is a particularly unique situation given the number of stressors that we're facing, both the threat of illness as well as financial strains and the isolation associated with social distancing and stay-at-home orders. Those with underlying mental health issues are particularly vulnerable. So the question is, what can we do to assist ourselves and others in weathering this storm and ensuring better mental health for our community? First and foremost, it's important to recognize that mental health is a part of health. We need to focus on how we can positively support and uplift each other and instill a sense of hope, which is critical during this time. We can protect ourselves by engaging in self-care. So it's important to know the facts. The facts come from those trusted authorities such as the CDC and your local health community. Limiting social media is another important strategy. The constant barrage and sensory input can be very challenging and difficult to absorb, so we need to allow ourselves downtime to take those facts into account, to digest them, and to determine how best we can respond and support our families. It's important to stay active. It's also important, and the number one protective factor during times like this is to stay connected. Stay connected to friends and family. We have to do that a little differently right now because we have the challenge of not being able to be close physically, be able to hug and support each other. So the use of technology is particularly important. Having that visual connection with others continues to remain the most protective factor we have in supporting each other and maintaining our own mental health. For many of us, we may need additional support. And the good news is there's a lot out there. We have a plethora of hotlines, there are websites, there are phone apps that help address a variety of issues from stress and anxiety to grief, substance use disorder, as well as crisis intervention and suicide prevention. We'll be providing a list of the resources that we've compiled that include both all of those things as well as community resources at the end of this. The other advantage that we have today through executive orders and changes within our regulatory agencies is the widely availability of telehealth, which includes tele-resources for those needing counseling services. Many of our community providers have now been able to leverage those changes to be able to continue to connect with previous patients as well as bring on new patients and support them during this difficult time. One of the most important things for us to remember right now is the addressing of stigma. Oftentimes, mental health and substance use disorder is viewed as a moral failing or a weakness. We need to recognize that this is truly a health condition, and like other health conditions, there are things that we can do to help ourselves, and at times we need the help of professionals to weather that storm. So for those that need help, seek it. It is a sign of strength, not a sign of weakness. If you know someone that is in need of assistance, be that arm, be that person that reaches out to them and help them connect with resources. Secondarily, for our healthcare workers that face the front lines, they have the same stressors that you and I have. In addition, they have other stressors that make this a very challenging time. They experience increased risk of exposure and infection. Their work environment is changing daily as we adapt to our current state. They're facing the illness and death of patients and colleagues. They have concerns for the safety of their family and friends. They often face stigmatization for fear that they may be carrying the infection home. They have fatigue and limited rest time, and they feel personal and team pressure. Many healthcare workers are already resilient and will not experience long-lasting distress. However, the stress during a pandemic reveals that usually 10 to 20% of healthcare workers are at risk for a new disorder, be that post-traumatic stress, insomnia, the use of unhealthy mechanisms to cope, such as alcohol and drugs, depression, and anxiety. Symptoms may appear after the outbreak is over and once we've gotten through the initial phases of the pandemic. The good news is these symptoms usually decrease over time. We have research that's come out of China for those that faced the pandemic first, out of 34 hospitals and over 1,250 healthcare workers surveyed. And it included an evaluation of the overall impact of COVID-19 on the mental health of the healthcare workers that cared for the COVID-19 patients. More than 50% of them exhibited symptoms of one or more issues related to mental health, including depression, anxiety, insomnia, or distress. The largest risk factors for our healthcare workers include the perception of heightened risk of infection, the longer duration of high-risk exposure, previous history of mental health issues, and the lack of social support. But like our public, Our healthcare workers have the same number one protective factor, and that is social connection. So continuing to reach out to our healthcare workers to support those individuals and to lift them up during this time is extremely important. So how do we care for our caregivers? Now and well beyond the pandemic, we need to be able to provide that positive support. I will say that one of the number one ways to allow our healthcare workers to feel much more comfortable with what they're faced is to arm them with knowledge, the skills, the equipment to face this challenge. And I'm extremely proud of the leadership of this organization under Alan Levine and Eric Deaton leading as our incident commander over the EOC. The communication is unlike anything I've seen in the past. Daily communication and a proactive approach to ensuring that our healthcare workers have the equipment, skills, and knowledge to face the challenge ahead of us, which should lead us all to feel much more comfortable that we're protecting our team and our community, both physically and mentally. Self-care is also important for our healthcare workers, so we have provided those tips and strategies to our healthcare workers on how they can best care for themselves during this time and things that they can do to make themselves healthier. The CDC has put out some specific healthcare worker resources, which are also important. Ballad has put a tremendous amount of focus on the mental health of our healthcare workers during this time. We've added a hotline for our healthcare workers to help work through stress, anxiety, provide techniques and strategies for coping, and connect to resources if needed. Additionally, we have a 24/7 connection to crisis resources. We have resilience workshops that we'll be putting together that we'll be able to deliver via webinars. And we have the ability to deploy resources to our facilities with COVID units, which include peer support to support those team members that are struggling with caring for these patients. We also have emergency assistance programs that provide direct counseling to our team members. I'm excited to announce today that in addition to the services that we've been providing internally to our team, we're going to open those up to the community. So the hotline that we started earlier this week that provides additional resources Monday through Friday, 8 to 6, to work through stress and anxiety coping techniques, in addition to our already 24/7 crisis intervention, will be available to the public as well as our internal team members. That can be reached through Ballad's Behavioral Health Respond Hotline, and the phone number is 1-800-366-1132. I'd like to thank the public in particular for their tremendous support of our healthcare workers and how we've come together as a community. Together we will get through this. Thank you. And now I'd like to introduce Alan Levine, our chairman and CEO of Ballad Health.
Thanks. Sorry for elbow or something, but first of all, I want to thank Trish. She and the behavioral health team with Ballad have been focused on this from the first day, and I will say one of the benefits that we continued even with the furlough that we just recently announced is the continuation of the Employee Assistance Program benefit. So people who were furloughed can continue to access that benefit that Ballad will continue to fund. And of course, as Trish just announced, we're making resources that we had been making available internally available to the community who, have questions about coping and how to manage through all this. I also want to commend Dr. Patterson and our physician leadership, Dr. Amit Vashist, Dr. Clay Runnels. They've been working as a team with our physician community that are both internal to Ballad, meaning our Ballad employed physicians, as well as physician partners out in the community to try to deal with some of the various challenges that we're all having to confront right now. The decision to close 6 urgent care centers is certainly important because of our desire to make sure we're making optimal use of the resources that we have at our disposal to take care of folks. There's some additional work that's being done with our urgent care centers that hopefully by Monday we'll be able to announce in terms of some support that we're going to provide the physician community out there who are taking care of patients who are suffering from respiratory conditions or maybe suffering from respiratory conditions. We believe our urgent care centers that are remaining open during this period provide some incremental opportunity to serve that population. And we'll have more to talk about Monday with respect to that. I want to announce something I think that's important. actually, before I do that, two quick comments. One, back to the data that Tony Keck provided earlier, we've been modeling this from the very beginning. We've been taking the national models and we've been applying what we know about what's happening in the region based on the data that's available to us. Now, I kind of joked with Tony earlier that there's a lot of travel to non-essential locations like restaurants. And so I did ask him if he could adjust the data Monday to discount the number of people that are in the drive-through at Chick-fil-A, because I'm not sure we want to count that, as I'm one of them. But I appreciate, in all seriousness, what the restaurants have done to create opportunities for people to get out a little bit and stay distant while they are able to enjoy some of their favorite food. Maybe not in the dining room, but certainly to go. And I think the way that the restaurant community has evolved to be able to respond to this and provide, some real needed respite for people, I think it's been very good. I'm announcing today something that we've invested in for a long time. Ballad Health has been very invested in telemedicine, telehealth. We're in 108 different schools throughout the whole Appalachian Highlands region, providing access to telemedicine for children. We've long used teletechnology for stroke and for other specialty services. All of our emergency departments are engaged electronically with Nice-Wanger Children's Hospital, so no matter where a child goes for emergency care, there's access to a pediatric emergency physician that can guide the local emergency department through the services that the child needs. And the technology is so advanced they can actually do real assessments of the child remotely. We're proud to announce today two major expansions of teletechnology through through a program that we call the Connect Care program. Connect Care is our brand name, or it's Connected Care, I should say, is our brand name for our teletechnology platform. There's two announcements we're making. The first is we are implementing a Connected Care region-wide virtual urgent care center. The Connected Care virtual urgent care center for anyone who needs urgent care for all types of minor illnesses that come up. As Dr. Patterson said, we're seeing a decline in urgent care volume because people properly want to stay socially distant, but we also recognize there's a need for people to see a physician or a provider. So by virtue of making it available through telemedicine, it's open to any patient, any individual from anywhere in the world who wants to access our services electronically. You don't have to be our patient to do that. We have on our website the information to guide you where to go if you need to access that service. In fact, I'm off my talking points here. Let me get that for you. But this urgent care clinic, this virtual urgent care clinic, is in addition to the vast network of urgent care centers that we have throughout the region. Currently we have 17. That'll come back down to 11 on Monday as we temporarily close six locations. But those 11 plus the virtual urgent care give you enormous access. And what we've done, we're establishing this access for a flat $30 cash per visit. That is a very low price per visit. We did that deliberately during this time because we want to make sure people can access the service. Regardless of what type of insurance you have, it doesn't matter. Our priority right now is access. The low fee, it's a flat $30 fee. You'll have access to a provider, to a diagnosis or an assessment, and if needed, a prescription. So the full service will be available to you. Incidentally, the way that we're making this available is a relationship that we developed with a company called Visuel. Visuel is a cloud-based virtual health platform that gives patients the ability to connect directly to their provider using a web-enabled device. You can use a laptop computer, a desktop computer, a tablet, or even a smartphone. It's got to have a front-facing camera and a microphone, but beyond that, all you need is an active email address and internet access to be able to use the Connected Care service. We're also proud to announce, in addition to the virtual urgent care that we're establishing, we're announcing that we're expanding our telehealth platform to 300 primary care and specialty physicians throughout the Appalachian Highlands region. Existing patients of those 300 doctors can call their Ballad Health provider to determine if the Connected Care telehealth is an option for them. In addition, our website will list out the physicians and mid-level providers who are available through the Connected Care, and then we'll provide the phone numbers for those doctors so you can call and make an appointment via telemedicine. The cost of a telehealth primary care or specialty visit would be the same as a traditional office visit. If you're insured, you should contact your insurance company and make sure the benefit is available. Most insurance companies during this period are permitting the use of this service. And if you're uninsured, you'll receive the discount based on our charity care policy. If you're below 225% of the federal poverty level, the service is provided for free. If you want to learn more about our connected care offerings, you go to www.balladhealth.org/connected care. When you go to that website, balladhealth.org/connected care, if you go to that website, you'll see access to the virtual urgent care to get more information about urgent care. You'll be able to see the provider community that is participating in our telehealth technology platform for primary care and for specialty physicians. As I said, Ballad Health has been invested in this for a long time, but we wanted to make sure that we did everything we can to make sure that people have access. A lot of people right now are concerned about going to the doctor. They're concerned about going places, in particular elderly or people that have other types of health conditions. That's perfectly acceptable. But what we don't want to do is see people go without care that really need it. And that's why this service is being enhanced and expanded as dramatically as it is. I'm going to go ahead and end this part of the press conference now, except to say that on Monday, as I mentioned last time we met, there will be over the course of the next week or so decisions that are being made at the market level related to certain consolidations of services as we try to reduce our cost structure during this time and frankly rationalize the resources that we have. Today we discussed the consolidation of our urgent care. On Monday we'll be announcing some additional steps that we're taking. You'll hear more from the market CEOs in the markets that are making those decisions in consultation with physicians, and you'll hear from the physicians as well about the rationale behind some of these decisions. So I think there's a very strict methodology that we're taking to make sure that we're doing things in an organized way so that we ensure our patients and their access comes first. And with that, I'll be glad to answer any questions you have.
All right, we'll go ahead and open it up for questions. First on the line, we have Trey Adams with WXVQ. Trey, do you have any questions?
Yeah, I guess my first question is, obviously with the data that you guys presented today in terms of how many patients that you all are taking care of and the social distance numbers that you all have presented, how important is it that the next couple of weekends that people continue to follow those guidelines so that we can flatten the curve?
I don't think there's anything more important. The success that we're starting to see, the modeling that Tony shared with you, the data, we did the same type of modeling looking at New York and New Orleans. You know, New York has an 85% reduction in social connection, meaning an 85% improvement in social distancing. New Orleans has seen about a 77% reduction. And the result of that is you see that the spread of the virus slowed down dramatically and the number of hospital visits is actually beginning to decrease. And while deaths are continuing to rise, that's a lagging 2-week thing. I mean, you'll start to see deaths come down as the number of hospitalizations decrease. So I think it's a great question. I don't think there's anything more important right now than the social distancing. And we're going to use this data. We'll make it available to media. We want to make sure that communities understand which communities are doing a better job of socially remaining distant versus some communities that are not. Right now, I think the one that we see that's done the best job is Washington County, I believe in Tennessee. But as Tony said, Hawkins County and Lee County in Virginia, Hawkins County in Tennessee, after there was a little bit of an outbreak there, we saw a big improvement based on the data that Tony shared with you. It's really important. It's going to be easy for people to see on the national news that things are getting a little better, it's going to be easy for people to conclude, oh, it's okay now. But that's when you'll start to see an increase in the number of cases again, and that's certainly what we don't want to see.
Trey, did you have an additional question?
I guess my other question was, I know that you all released information as it relates to rapid testing. I believe it was last week. Do you all have an update as how rapid testing is going right now?
It's working well. We've got the question is how is the rapid test working? It's working quite well, and in fact, we're still anticipating here shortly receiving the additional analyzers that we purchased. Gosh, I'm about to get myself in trouble. One of our strategies with the urgent care, which we're going to wait till Monday to announce, I might as well talk about it here, although we're not ready to execute on it yet. We bought 4 new analyzers that run the rapid test. 3 of the 4 new analyzers can do 4 tests per hour. You've seen a lot of stories on TV about this Abbott analyzer, and we commend Abbott for coming out with that analyzer. But the analyzers we're using are actually better because we can run 4 tests at a time. I'm sorry, I said 4 tests per hour. I meant to say 4 tests at a time. We can run 4 tests at a time with the analyzers that we're acquiring. Our plan is to deploy 3 of those analyzers in the urgent care in Johnson City, Kingsport, and Bristol. And by doing so, if there are physicians in the community that are seeing patients in their private practices that need respiratory follow-up, they can be referred to our urgent care where we can do influenza testing or other types of respiratory testing. In addition, we can do the rapid test for the COVID-19 disease. And so we're trying to position ourselves to get these results to people as quickly as possible. Once we get the 4th new analyzer, which we anticipate getting any time now, that analyzer will be able to increase our capacity from 50 per day to 400 per day, plus what these other 3 analyzers can do, running 4 tests per hour. So I feel really good about what our capacity is growing to. And so far, our employees and patients who have severe symptoms have really benefited from the rapid test.
Thank you, Trey. Next, we have Brittany Nade with the Elizabethan Star. Brittany, do you have any questions?
Yes, I do. I was wondering what's going to happen to the staff of these consolidated urgent cares. Are they going to be furloughed or are they going to be sent elsewhere?
Many of the question is what would be of the staff who are at these urgent cares. Many of them were on the initial list for furlough. So they will either be furloughed or they will be reassigned based on what the needs of the organization are. But this has already been communicated to those staffs.
Brittany, do you have an additional question?
Yes, I was also wondering how people pay for urgent care if they choose to use that option.
They can pay online right then and there. They can use their credit card, a debit card. We can do it right there online, and it's very easy. The service itself is not a new thing. This is being done in a lot of places all over the country. It just hadn't been done here. But it's a very easy process to go through. Now, let me say this. Because we're just implementing it, I'm certain we'll have a few struggles here and there as we get it ramped up and as demand increases. We would ask people to be patient, but we've been testing it, and so far it's been working quite well.
Thank you, Brittany. Next, we have Jonathan Roberts with the Johnson City Press. Jonathan, do you have any questions?
Yeah, I do. I wanted to ask Ballad where they're projecting to keep all in Northeast Tennessee and Southwest Virginia as this.
Tony, do you want to take a stab at that? I mean, you're talking about which counties we're projecting, or are you talking about, maybe if you can clarify that question.
In general, when are you expecting to reach the peak in the Tri-Cities region?
When? Okay, I apologize. I thought you said where. When? Well, we had projected about a week and a half ago that if things had not improved, that we were projecting somewhere around 4 to 6 weeks from about a week and a half ago, so about a month. Why don't you come up here? I think because the numbers have changed because we've gotten better. Why don't you come over here and?
Yeah, the models, and we're running several models to triangulate between all the different models. They're changing very rapidly. And I know people have probably watched online as the president and his advisors have talked about changing models. We're doing the same thing and tracking that very carefully. We think within the next week, we will have a good idea of where our models are telling us that they're going. It's anywhere between 3 weeks and 8 weeks right now. And so there's a range. And for those of you who are familiar with hurricane models where you see that big cone and they're trying to predict where the center of that hurricane is, right now we're doing the same thing with the disease, and there's a big cone of uncertainty as we try to predict. But every day that we get more data, it gives us a little bit more certainty. But right now we're looking anywhere within 3 to 8 weeks. And as we get more information and feel more confident about those models, we'll certainly report that to you.
Thank you, Jonathan. Do you have another question?
Yeah, I do. More on the peak. When we reach that peak, what does that mean for people? Should people be expecting to return to their daily lives, or should we continue social distancing as much as possible?
Well, let me first, I want to follow on to something Tony just said. This is not linear. Whatever we predict now, it's based on the data we have today. It's based on what we see in terms of the effectiveness of social distancing. If people see things on national TV that make them believe it's all gone away and people stop social distancing, then you're going to see the projections change in terms of when we will see that peak. So I just want to be clear, it is not a linear thing. This thing changes based on how the public behaves. I don't want to speculate on when we get back to normal or how rapidly we get back to normal once we peak. I think there's going to have to be a lot of input from the leadership of Virginia and Tennessee, and we'll take a lot of our guidance from our departments of health and from the governors of our states in terms of what they're seeing. And a lot of what we're hearing is there's going to be a look at different parts of the states based on what the severity of the spread of the disease has been. So I'm not sure it'll be a one-size-fits-all model. I think it'll be depending on how effective we are at stopping the spread. The good news is if we continue on the path that we've been on, there's a very good chance we'll be able to manage the peak with the current capacity that we have. And that's what we had hoped from the very beginning, was that if we're successful pushing that curve down and flattening that curve, then we would stay within our capability to serve our community and not get overwhelmed, either losing, we'd have enough PPE, we'd have enough beds, we'd have enough staff to be able to serve the needs of the community. And I think if things stay the way they're going, I believe we'll be in a position to care for the needs of our community with the current resources that we have.
Thank you, Jonathan. Next, we have John Engel with WCYB. John, do you have any questions?
I do. Alan, I'm really interested in this connected care platform. Go into that a little bit. You mentioned 300 providers that'll be moved in on this. That sounds like a pretty big footprint. I mean, you mentioned that this can serve patients anywhere in the world. It's not exclusive to Ballad patients. Would not be exclusive geographically. Does Ballad Health see this platform as an extension of its service in the Tri-Cities region, or is this aimed at even a larger purpose or goal of further market penetration elsewhere? What's the goal?
The question for those who are listening, what's the goal with our virtual health platform, both with the announcement about the virtual urgent care center that we've created, as well as the 300 providers that are now on the platform. And by the way, that number is growing. I spoke yesterday to Dr. Mark Chang, who's the CEO of Ballad CVA, the Ballad Cardiology Group. And their physicians right now are in the process of training using protocols established nationally for cardiology for telemedicine. So what we're doing in many ways is cutting edge and establishing a lot of the protocols for the way telemedicine will be delivered. John, your question's a good one in that, first and foremost, our objective is to make sure we take care of our patients and we take care of the people in this region, even if they currently are not our patients. If your primary care doctor is a Ballad Health doctor, we're going to take care of you through telemedicine because we now have that capacity extended to you. If your doctor is not one of our primary care doctors, or even if you don't have a primary care doctor, you can use the Ballad Health urgent care just as you used to be able to drive to our urgent cares before. So our goal is to make sure everyone in this region is able to benefit from the services that we provide. If we happen to get people from outside this region who determine they want to use our services, that's fantastic. The more Ballad can grow its footprint, the better it is for creating jobs here, the better it is for growing the Ballad Health enterprise. And that's a good thing for this region. Let me tell you, we're about to roll out in June our conversion to Epic, which is a massive investment, more than $200 million investment that Ballad Health has made, that will integrate all the physicians in this community into Ballad Health and vice versa. So no matter where you go, your physician or your care provider will have access to the Epic footprint. And therefore, there's some pretty cool stuff, John, that we're going to be able to do. For instance, if you have a smartphone and you show up at one of our care sites, because you're using a smartphone, if you've enrolled in our app, in the Ballad Health app, which will be rolled out here in the next 60 days, when you walk into the door, you'll be registered without even having to sit and go through a registration process. That's a really cool technology that we can provide our patients that will streamline care, reduce the cost of care, and make it a lot more effective so that their time is spent more with doctors and not with people collecting information, data and insurance information. So this is the beginning of what's going to be a major investment and a major rollout of technology that's going to put so much power at the fingertips of patients, power they've never had before, where they'll own their own data, they'll own the ability to do online registration, online scheduling of appointments, the ability to connect with physicians online or through technology. This changes everything. And so sometimes it takes a disaster to push organizations to do what the policy should have been all along. And here we are. I'm proud that Ballad we're not just sort of playing defense with this pandemic. We're sort of determining how we can sort of get out there and play a little offense and make healthcare more easily accessible to our patients and ultimately reduce the cost curve. Before all this pandemic happened, Ballad Health was reducing the cost of care for people in this region. That's a provable fact. But this is another example of investments we're making that will even further reduce the cost of healthcare for the people in this region. I don't know if that answered your question. It certainly.
It does. Just a quick point of clarification on that question before I move on then. Will there be an active effort to market or expand this service, push it outside of the market beyond the Tri-Cities region, or would that just be a nice, byproduct that would not be, or would be more of a passive action?
Oh, I think we'll be very assertive with communicating the benefit of this service, and that communication will certainly go beyond the boundaries of our region. If people in Knoxville want to take advantage of it, that's terrific. If people in Asheville want to take advantage of it, that's great. It's a service that we are able to provide, and the more people we can help, the better.
Thank you, John.
And on the logistics side, will there be, is it like an active staffing environment, or is it, like a appointment based, or will people, staff members be dedicated to whatever this virtual platform is, standing by for patients by appointment? How does the logistical work?
Both. There'll be employees dedicated to it, and it also will take advantage of our existing capacity.
Thank you, John. Next, we have Blake Lipton with WJHL. Blake, do you have any questions?
Yes. Can you just put decline in overall urgent care volume?
I'm sorry, what was the question?
The percentage of overall decline in urgent care volume.
I would say we'd probably seen about a 60 to 70% drop overall. It depends on Blake. It depends on the center, and if in the aggregate, we've probably seen about a 60% reduction. Some centers have seen lower than others in terms of decreases, and the 6 that we've decided to consolidate were the ones that were seeing the lowest volumes, and it made the most sense to consolidate those into other centers that had the capacity to serve those patients.
Do you have an additional question, Blake?
Yes, with the rapid testing as well as just has there been any changes
No, nothing's changed there. And Blake, by the way, let me go back to your previous question. Just for context, on a normal year, we will see roughly 250,000 urgent care visits. Is that about right? I would say I'll get you a number confirmed, but we generally see about 250,000 urgent care visits in an annual year, give or take. And but I want to double check that number. We'll get that number pushed out to you so you have clarity on what that number is, because I do think contextually that's important. We see generally 4 million outpatient contacts a year overall. Ballad Health does. So if you have 4 million patient contacts a year, we've seen about a 75% aggregate reduction in our overall outpatient volumes. So we've gone from about 4 million outpatient visits per year down to about 1 million. And so you can understand why we're looking to consolidate some of these care sites so we could just make better use of our staffing resources and our supply resources when you're talking about a quarter of the volume you would normally see. And we'll get you some hard data on that so you have some real data to report on.
Thank you, Blake. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any additional questions?
No, thanks.
All right, thank you, ma'am. Next, we have David Floyd with the Johnson City Press. David, do you have any questions?
Hey, I do. Alan, especially in light of the furloughs, I was wondering if you could kind of give a general overview of how you guys are handling your inpatient services at your facility.
Sure. The same way we always do. We part of the other part of that furlough story, which I have to say, David, I read your story yesterday, and I think you did a great job articulating this wasn't just a furlough. It was also an investment into nursing, direct bedside nursing, with investments into RNs, LPNs, respiratory therapists, and certified nursing assistants. The reason that we're guaranteeing those bedside hours is because we want to make sure we keep our capacity to do the bedside nursing care. And so we're handling it the same way we always have, even if you're called off. Even if you're called off, you would still be guaranteed whatever your pay was going into this. So right now, our bedside nursing care is excellent. It's being handled by incredibly competent, highly qualified nurses under the supervision of incredible physicians and our hospitalists and others who are taking incredible care of patients. I've gotten some great emails from patients who've said, we sure appreciate the fact that not only did we get great care, but that the nurses went out of their way to help us with FaceTiming our family members so that we can actually see our family, because right now our patients can't even see their family, which is heartbreaking to hear, but our nurses are doing everything they can to make that happen for the patients. And I'm very grateful to our nurses for doing that.
David, do you have an additional question?
I did another question, but I wanted to follow up on that real quick. So, for example, I mean, if someone needed to have an emergency surgery, you guys still have the capacity
Yes.
for that service?
Yes, absolutely. The way we handled the furlough is if we had staff, surgery is a great example. If your surgery volume's down 60, 70%, then you've got staff before we did the furlough that were being called off quite a bit. And then those staff weren't getting paid anything, or they were using up their paid time off. So what we did was, in many cases, we furloughed the staff that were being called off, but the staff that were continuing to be working, those staff are still there. Now, if we get hit with a surge in volume, whether it's surgical volume or any other type of volume, part of why we said when we furloughed, if you're called back, we expect you to come back. And we would certainly expect them to come back if we call them back in. As it relates to bedside nursing, those staff, the nurses that work at the bedside, if they're called off, currently they're guaranteed, if they were in our system as a full-time nurse, they're being guaranteed full-time hours. If they were in the system as a part-time nurse, they're being guaranteed their part-time hours, even if they're called off, which means if we have an increase in volume, we will call them in, and we've not seen any disruption in bedside care as a result of that.
David, you had an additional question?
Yeah, and you might have already addressed it, but I guess, we were talking about the
Well, a good example, I mean, their primary responsibilities haven't changed. Their primary responsibility, if they're a nurse that works at the bedside in the acute care setting, their primary responsibility is to be available to provide bedside nursing care. Now, that having been said, we're trying to add more people to our call center, where we need nurses to help in our call center. So it might be that we call and say, we need you to help us with staffing our call center, where the public is calling the call center and they want to be able to speak to a nurse about whatever their issues are as it relates to either testing or even as it relates to telemedicine. And in that instance, we will ask them and expect that they will be willing to work in the call center. Now, we will not ask anyone to do something that they are not either qualified to do or that's outside their scope of practice. In other words, if you're a nurse, we're not going to ask you to do something that's beyond the scope of your license. But the expectation is they'll keep doing the work that they are hired to do. And I will say, yesterday I was in Lisa Smithgall's office while she was calling some of our case managers that had been furloughed, and asking them to come in and help in the call center. And the overwhelming response was, yes, I want to help any way I can. So we're very grateful for that. And we're all going to have to do things differently than we've done before. Our administrative team is being asked to do things that are, not necessarily in their core comfort zone, and that's okay right now. We all have to pitch in where help is needed, and that's what I think ultimately is expected, and what we hope for is that everybody will pitch in where they're asked to pitch in, so long as they're qualified for it. We don't want them to do something they're not qualified to do.
Thank you, David. Next, we have Tim Dotson with the Bristol Herald Courier. Tim, do you have any questions?
Yeah, one of a question about that. So someone, I know the advice has been that if someone thinks that they have symptoms of COVID-19, they should call Ballad Nursing Hotline. But if someone has not done that and they present to the facility saying they think they have it or they think they have symptoms, what are staff doing in situations like that where people do show up and they haven't called ahead?
Well, if somebody shows up, what we tell people is call the Nurse Connect, because that's the most efficient way to get into the system. And if you call Nurse Connect and you have severe symptoms, then the nurse will have you talk to a physician. And if the physician determines that your symptoms indeed are severe enough that you need to get to an ER, they will refer you to an emergency department. Now, if somebody shows up to the emergency department and they have symptoms, they'll be evaluated. They'll have a medical screening exam, just as you're supposed to have, and the nurse at that time will make a determination as to whether or not you've got an emergency, and a physician will make a decision. Now, what they'll typically do, I'm not a doctor, but what I understand about the process is the first thing they'll try to do is rule out other respiratory conditions, because the likelihood is it could be flu or RSV or other more routine respiratory conditions, which we have the capacity to test for as well. So first we try to rule that out, and if those things are ruled out, then you would be tested for COVID-19. And because we now have the rapid test in the hospital, it's very likely as an emergency patient presenting with an emergency condition that they would utilize the rapid test as opposed to referring to an outside lab. I will say, because of the capacity expansions that have been seen all over the country with testing, the outside lab turnaround times are improving. So whether you have the rapid test or you're using an outside referral lab, the reality is that the testing turnaround times are improving rather well.
Tim, do you have an additional question?
No, that was it. Thank you.
All right, thank you. Next, we have David McGee with the Bristol Herald Courier. Dave, do you have any questions?
I do, and I want to ask about call center volume. We're hearing that people are having maybe some wait times or to get called back. Can you talk a little bit about the volume of calls that you're getting and what kind of trend have you seen there?
Yeah, actually, we monitor that every day. I get a report, and Eric Deaton gets a report. We've had a total of 24,000 calls, almost 25,000 calls. About 1,200 of those are referred to a physician. About 1,400 went to testing. The numbers aren't going to add up exactly because they all go different routes within our protocols. There have been abandoned calls. There was at the beginning, towards the middle of March, when we first started Nurse Connect, we had a major surge in volume where our abandonment rate went up as high as 50%. That was several weeks ago. We staffed up the call center quickly. We had to train people and get it staffed up. And as we've staffed it up, as I don't know, you can't see it, but you could see that the abandonment rate has dropped pretty substantially. Right now, the abandonment rate is somewhere around 9%.
Majority of those are gone to 27%.
Yeah, and the majority of that Eric was pointing out, thank you, we track our calls by the second. And the majority of the calls, the 8 or 9% abandonment, the majority of those are dropping within the first 20 seconds while they're on hold. So this is a constant, everyday work in process where we're evaluating this to make sure that we capture every call that comes in. Unfortunately, there are some folks who don't want to wait, and we understand that. What I can't tell you is how many of them called back and got right through. So if the abandonment rate's 8%, the majority are dropping within 20 seconds. What I can't tell you is how many of them call back again and are able to get right through. So what the true abandonment rate is, I don't think I can tell you, but we are tracking it, and we are holding ourselves to try to improve on this every day. But it's not perfect, and that's a fair question. And for those who did drop off because you had to wait, we are sorry for that. What I would tell you is keep trying, because the process does work. It really does. And by the way, David, let me just say, I read your story yesterday as well. I got to tell you, this is a very to write the stories about the furlough and the complexity of what we announced the other day. That was very difficult to capture for writing a news story. I have to say, and I don't expect this to happen often, but I give a lot of credit to our media, who are really doing a great job of capturing the information and the facts and reporting the facts in a way that I think most people are able to understand the complexity of it. Because contextually, this is very difficult information to report on. And so I do appreciate the work the Bristol Herald Courier, Johnson City Press, the Greenville newspaper, the Irwin newspaper, all of it. I've been reading them all. And I think you guys have done a really great job of taking very complex information and distilling it down in a way that the public can understand the context. So I want to thank you for that. Was that the last question?
He has another question.
Oh, sorry.
Dave, do you have an additional
I was
question?
filibustering you, David. I'm sorry.
Thank you very much, Alan. I'll pass that along to my editor. One of the questions, Jamie said 300 beds as opposed to 200. Where might you have identified those additional scope beds?
Yeah, we've been slowly ramping up capacity in all of our, pretty much most of our hospitals that can take care of COVID patients. Right now it's 313 beds. That does not include Greenville Community Hospital West or Nicewanger Children's Hospital. At Greenville Community Hospital West, there's 56 beds that are available for a surge. And at Nicewanger Children's Hospital, we've got 17 beds available for people 20 and under, or under the age of 20, should they be needed. Eric, do you want to comment on this a little bit?
No, I can tell you that what we've done is had a decrease in census. We've been able to expand those beds beyond what we originally had thought.
Yeah, the freezing of the elective procedures and the decrease in the inpatient volumes we've had, what Eric was saying is that we've been reconfiguring some of that bed capacity to be available for surge capacity should the need occur. I could tell you we have the primary hospitals are Johnson City Medical Center, Holston Valley Medical Center, Bristol Regional Medical Center, Johnston Memorial Hospital, Indian Path Community Hospital, Lonesome Pine Community Hospital, and Greenville Community Hospital East. And again, that adds up to the 313 beds, those hospitals I just mentioned, plus you would add 56 beds for surge capacity at Greenville Community Hospital West, plus you'd add 17 beds at Nicewanger for people that are 20 years or younger for taking care of that special population. So, and those 17 beds would be adding to the Johnson City Medical Center complement, since Nicewanger is located there at Johnson City Medical Center.
Thank you, Dave. Next, we have Richard Rourke with the Irwin Record. Richard, are you still on the line? And
I have a question about, we have our second case of COVID in Unicoi. Is there
Sir, we can't do that. We can't release identifying information, and that would be that information could help people identify who it is. So we obviously leave it to the individual and the family. If they want to talk about it, they're welcome to, but we certainly want to respect their privacy.
Richard, do you have an additional question?
Yeah, my second question is, I know that we had the first case, it's been a little while. Is there any updates that that person recovered, or is there any updates on the first case in Unicoi County?
So here's what we're working on right now, and this is a very difficult thing to do. A member of the Board of Mayor and Aldermen in Kingsport reached out to us and suggested that we start publishing recovery rates, because that would be very encouraging information. The challenge is, and it's not as it sounds easier than it is to do. For instance, we may have over 100 positive cases that we've identified, and a certain number of them may be in the hospital, and there may be a certain number of cases that would call PUI, persons under investigation. And there's about a 2 to 3 week lag period from the time they enter the hospital till they're discharged, or in the unfortunate event they don't make it. We've had a few of those cases. So it's hard to marry up our internal data with the state data. The state of Tennessee is reporting recoveries overall, but they're not doing it by county at this point. So we're just trying to marry up our data with the state data to come up with what the right methodology would be to report recoveries. Whatever the recovery rate is, it'll probably be a 2 to 3 week lag, about a 3 week lag. Eric was correcting me, before you can actually accurately report recoveries and have that data be accurate. So we're working on that. We will get to a point where we can start reporting recovery rates, but we want to make sure we don't misinform the public.
Thank you, Richard. Next, we have Richard Lovett with Cumulus. Richard, are you still on the line? All right, next we have Taryn Young with the Coalfield Progress. Taryn, are you still on the line?
Yeah, my first question is Lonesome Pine Hospital, do you see that being transitioned back with all of the departments back in it after the violence has gone down, or what will happen with that hospital?
I think the question is what would happen to Lonesome Pine Hospital after all this. I think you'll find that Lonesome Pine Hospital will continue to be a very important asset within the Ballad Health system. It may not look exactly the same as it looked before in terms of the service mix, but that has nothing to do with COVID-19. It has to do with our overall plans and strategies for that market. But Lonesome Pine will continue to have a critically important role within the Ballad system.
Do you have an additional question, Taryn?
Yeah, also in regards to Lonesome Pine, do you know how many COVID-19 patients are there, and is there rapid testing available there?
We've had 2 COVID patients at Lonesome Pine. Are they still there?
I believe so.
Well, let me confirm whether they're still there or not, whether they've been discharged or not. But we did have 2 patients at Lonesome Pine.
All right, and we'll confirm that information, Taryn, and I'll get back to you. Thank you all so very much. That concludes today's media briefing.
Thank you.